the people who go to gym, all the people who take steroids for the muscle building may not get affected because they'll be not taking in the lethal level. They may be taking in the sublethal level. Even smokers, if they are smoking within some limits, it may not damage. Alcohol, social drinking, weekend drinkers, they are not affected because the body can cope up with certain amount of these use of these abuse of the organs. But once the limit crosses, then the body cannot cope up with these things.
Okay, so now we have talked of the causes of pre-testicular.
Yeah.
How do we treat this?
Yeah.
How do we identify?
Yeah. Again, it depends upon the cause I told you, we have to first analyze what is the main problem issue, whether it is endocrinal disorder or whether it is congenital abnormality or general debility or chronic illness. So rule out all the causes, which I listed, about 12 to 13 causes. If there are treatable causes like the general debility, general illness, diabetes, then you can definitely cure that or treat that, and the sperm count may come back. And if it is endocrinal, give the required hormone, replace the hormone. And if there is increased hormone, decrease the hormone. If there is low hormone, increase the hormone. If there is hyperprolactinemia, decrease the level of the prolactin. If it is hyperthyroidism, give anti-thyroid tablet. Or if it is hypothyroidism, give thyroid tablets. That is, balance the hormones. If it is more, reduce it. If it is less, increase it. So endocrine disorders can be treated. What cannot be treated are these congenital abnormalities. Congenital hypogonadism, Klinefelter syndrome, Robertson syndrome, no-fill syndrome. They cannot be that easily treated because they are beyond the genetic because that it is genetic, congenital abnormality. We don't have genetic engineering right now, not available. We cannot change the genes right now. That is still in trial therapy, infancy, very infancy, to change the genes. Right now, with our present knowledge of medical sciences, it is impossible to change those genes. So genetic abnormalities, they cannot be that easily treated. So brain tumors or brain injury, they can be treated. Yeah.
But the genetic abnormality in the...
And other conditions, general illness.
Okay.
Yeah.
So how much percentage of male subfertility, of those males affected by subfertility, have these genetic disorders?
Out of the, say, if you take about 100 men with infertility, out of 100 men with infertility, the pre-testicular cause, post-testicular cause, and testicular causes may be something like 30, 33, 40%, all equal. That is pre-testicular cause, testicular cause, and post-testicular cause. Coming to pre-testicular causes, which may form out 30% of those infertile men, out of this, about 10% are genetic abnormalities, which cannot be treated. About 20% are endocrine disorders, they can be treated. About 30 to 40% are the factors which have been made by the person himself, obesity, then this general debility, drug abuse, chronic alcoholism, and chronic smoking, tobacco. All these, they are self-inflicted injuries to the body. They can be treated by changing the lifestyle of the person. They form about 20 to 30%. So, depending upon the pre-testicular cause, if it is due to general condition, general debility, we can treat it. If it is hormonal imbalance, we can treat it. What cannot be treated are mostly congenital abnormalities.
Right.
And tumors, craniopharyngioma or brain tumors. They cannot be that. Even if you remove the tumor, the functioning of the pituitary may not come back to normal. Yeah.
Okay. Right. So, for example, because lifestyle choices are one of the leading cause of pre-testicular subfertility, if somebody is drinking, doping, smoking, and abusing drugs, and they stop make changes in lifestyle and they lead a healthy lifestyle, they will be able to reverse the cause.
Yeah, possible. It depends upon how much damage has already occurred to the testis.
Oh, you
If
can't
the damage
undo
is
damage.
severe, no, because of these, the testis might have already been damaged. And if it is irreparable damage due to these conditions, even if we change the lifestyle, the testis may not respond. So pre-testicular causes, they depends upon how long you are smoking, how long you was alcoholic, how long you was using drug abuse.
Okay.
So it depends upon the duration of it, how long you was chronically ill, how long this liver was damaged, how long the kidney was damaged. If the damage is severe, even if you change the lifestyle, those organs may not come back to normalcy. And the result is that they, even if you change, the person may not. For example, steroid abuse. If a person was abusing the steroids for, say, more than 1 year, 2 years, 3 years, the damage may be permanent. And even if he stops, he may not produce the adequate sperms. So they should identify the cause as early as possible, so that it is reversible. For example, chronic alcoholic. If the cirrhosis is severe, even if he stops the alcohol, will the liver come back to normalcy? It may not come back because the damage is beyond the repairable limits.
Right. So I'm just very interested in the steroid abuse because I know some people who go to gyms regularly.
Tell me, Jamil.
So will they? Will all of them be affected, or will just a few people be affected if you are abusing steroids?
Yeah, all are not affected. Because when they started is important. If they started before the marriage itself, before the reproduction itself, then there may be long-term effect and it might damage. But if the person has started in the midlife, if he has already produced the children, he may not be knowing that it has damaged the sperm count, because he has got one kid already. Yes, okay, let me manage with one kid. So when this occurred, plays a major important role, and the duration, and when this misuse or abuse started, all those things come to count.
That is bad news for a lot of people.
No, luckily, most of the people, they take these steroids or the proteins within some permitted limits. So all are not damaged. All the people who go to gym, all the people who take steroids for the muscle building may not get affected, because they'll be not taking in the lethal level. They may be taking in the sublethal level. Those who want to try to do extraordinarily more and try to take more than the prescribed limits, then they'll end up in problem.
Right.
Even smokers, if they are smoking within some limits, it may not damage. Alcohol, social drinking, weekend drinkers, they are not affected, because the body can cope up with certain amount of these use of these abuse of the organs. But once the limit crosses, then the body cannot cope up with these things.
So tell us the limit.
No, there is, I don't advise them at all. I don't advise anybody to start smoking because, Dr. Sharath Kumar has said that if 1 or 2 smoking will this one. I don't advise it. And social drinking is okay, because it won't affect the fertility of a person. As a social drinking is weekend drinkers or weekly 1, 2 or 3 days, and the limit is about say 1 large if it is a hard liquor like whiskey or brandy, and if it is wine, 1 bottle, that is about 750 ml, and if it is beer, 1 or 2 bottles, that is weekly 2 or 3 times. That is the permissible alcohol limit for general health also, and for sexual health as well as for reproductive health. But I am not advocating the people who are not alcoholic to start. The message should not be taken in a wrong sense.
Right, got it. Dr. Sharath, the very interesting point that you made tonight is that if somebody has tumor, even if the tumor is operated on, even if the tumor is removed, it might impact their subfertility because the pituitary.
It might have already damaged. It might have damaged.
Yeah.
For example, craniopharyngioma. Even if you remove the craniopharyngioma,
What is
the
that?
pituitary,
What tumor is that?
that is tumor of the pituitary tumor. Pituitary tumor. Even if you remove that tumor, the part, the leftover pituitary, which is left over there, it may not be functioning because it might have already been dead by the pressure effect of the tumor. So removing the tumor itself may not reverse the fertility. And secondly, any tumor, it will be followed by chemotherapy or radiotherapy. That will further damage the rest of the pituitary and hypothalamus.
And this damage, is it like permanent or can?
The cytotoxic drugs and radiotherapy, they act immediately, right from day one, because they kill the germs, they kill the good tissue also. Right. Because we don't have cytotoxic drug, which will selectively go and kill only the cancer cells. They will kill the normal cells also. Radiation also. They don't selectively go and kill the cancerous cells. They'll kill the normal cells also. Okay. So that's how the damage will be severe.
And we cannot reverse this damage?
Difficult. Okay. We have to wait and watch after stopping the chemotherapy and radiotherapy. Wait for 3 to 6 months. Okay. If there is reversal of the testicular function, then fine, he is very lucky. But it cannot be assured.
Okay.
Yeah. Okay. Jamir is looking at the watch, is it? Yeah.
No, I'm not. I'm looking at my notebook actually.
Okay. Yeah. Is there anything else? Yeah.
I came across a terminology called idiopathic infertility.
Yes. Oh. I had told in the last time. Idiopathic is whatever investigation you do, all the reports will be normal. You take semen analysis, you take blood test, you take hormone test, you can do general tests. All tests will be normal. But still he will be able to or not able to produce the child with the partner. That is called as idiopathic. That is unknown cause. That is, with the present available knowledge, medical knowledge, we are unable to find out the cause. There is some cause, but we are unable to find it out with the available tools right now. That requires more and more investigation. Could be some genetic engineering, there could be some DNA malformation in the sperm, which we don't know to test right now. That is called as idiopathic. That is, idiopathic is something like we don't know. Yeah. Still we accept that we can't find out. Yeah.
Right. So to sum it up, pre-testicular form of subfertility is one where the male genital parts are working, everything is working, they have no sperm count or very low sperm count. Which
yes, exactly. Of perfect definition.
Yeah, and this can be multi-pronged. For example, it can be hormonal imbalances, it can be lifestyle choices, it can be genetic disorder, it can be congenitality abnormality. Are all multi-pronged. And some of them are treatable, some are not treatable. For example, genetic disorders are not treatable. The rest can be managed. For example, if you have got higher hormones.
We can manage. Most of these things can be managed. And the response depends upon the severity of the condition.
Okay.
If it is borderline oligospermia, most of the treatments will help because the subfertility is borderline. Just increasing the sperm count by 1 or 2%, he may impregnate the partner. But if it is so severe, it is 0 or 1 million or 2 million, whatever the drugs and medicines we give, it may not be able to bring the count up to the required level, that is 15 to 20 million. So it depends upon the severity of the disease.
So a lot can be done, but again, there's certain limitations to everything.
Yes.
And anything which is severely affected we will not be able to reverse.
The success rate will be low.
That's wonderful, doctor.
Yeah.
Well, thank you so much for the time. I've taken
nice. No,
minutes.
it's my pleasure, Jamir, to always to be associated with this your health care system, because it gives a lot of insight to our own knowledge. By spreading the knowledge, we get more knowledge, because the way you ask the question, that will enlighten me to read more and more about such things, because some things we might have not touched upon also. So it will be really the interaction and whatever the webinar we are having, that will be very, very helpful, not only to the listeners, but also to the persons who are conducting the show, because for conducting the show, we should have prepared very well. And that itself is the knowledge, increasing our own knowledge because studying more and more things. So it's an opportunity to not only to spread the knowledge, to increase the knowledge also.
Very true.
Just like light. If you light a lamp, we get the lamp, and with one lamp, we can lamp thousands and thousands of lamps. Yes. But one of the first light is important. Then spreading is very, very important.
Very true. Very true. On that note, I thank you so much. God bless you. And we will again for testicular male fertility issues next.
Sure. We'll touch upon the testes.
All right then. Thank you so much.
Thank you, Jamir. Thank you, Jamie Healthcare System, for giving me an opportunity. Thank you, listeners. Good night.
Good night. Bye.